Welcome to the China Health Pulse podcast, where we explore the forces shaping China's health system, medtech innovation, and global health influence. I'm your host, Dr. Ruby Wang. I'm a physician, health strategy consultant, and founder of the CHP newsletter. China now sits at the center of global health, from supply chains to biotech breakthroughs, from shifting policies to unstable geopolitics. It's a fascinating and ever-changing landscape. In each episode, I speak with the true experts who have dedicated years to working in and with China's health, across policy, industry, academia, and well beyond. These candid and human conversations provide real and rare insight into how care is delivered, how decisions are made, how lives are interconnected, and why it all matters, far beyond China's borders. This special 1st of December episode on World AIDS Day marks a collaboration between Liu He at Peking Hotel and Ruby Wang at China Health Pulse. Leo and I are thrilled to welcome one of the world's leading experts on HIV in China. Professor Joan Kaufman has worked at the intersection of public health, policy, and social justice for more than 4 decades across the United Nations, philanthropy, and academia. Her work has profoundly shaped how the world understands health, rights, and China's role in both. Joan first moved to China in 1980, working with the United Nations in Beijing during a pivotal moment when China's health system was just beginning to reopen to the world. In the 1990s, she helped establish the Ford Foundation's Beijing office, pioneering programs on women's rights, reproductive health, and HIV prevention. Then from 2002 to 2012, she led China programs for the International AIDS Vaccine Initiative, building bridges between Chinese scientists and global vaccine efforts.
Spanning academia, Joan has held senior roles at Harvard, Columbia, Brandeis, and Tsinghua University, and she founded and run the AIDS Public Policy Project at Harvard Kennedy School of Government from 2002 to 2010, served as director of Columbia University's Global Center for East Asia in Beijing from 2012 to 2016, and taught global health and social medicine at Harvard Medical School. And today she serves as Senior Director for Academic Programs at Schwarzman Scholars, where she mentors the next generation of global leaders to think critically about China's role in global health and development. And Joan, it's such a pleasure to have you with us here. And both Ruby and I first met you at Schwarzman Scholars. She is obviously a young and rising global leader. And I am not, but still somehow the program selected me anyway. And it's particularly special to speak with you for our episode on World AIDS Day and reflect on the arc of China's HIV response, your life's work at its heart. First question to get us started. What's up with the poster behind you?
Yeah. Well, first of all, thank you both so much for inviting me to do this podcast. I'm really honored. And, two of my favorite alums out of our 1,200 alums so far, all, in my opinion, future global leaders in one way or another. So, including by your podcast series and, your efforts to really help digest China and the world at this particular pivotal moment in history. So let me start by I can say a little bit about this poster, which I'll put into firmer view there. Began my career in China in 1980 to 84, as Ruby mentioned, working for the UN Population Fund. And one of our big projects and a big reason that Deng Xiaoping invited the UN Population Fund into China in 1980 was to do a scientific census in the years following the Cultural Revolution, really get a proper count of the Chinese population because, one of the goals goals in the early 80s at the beginning of the reform and opening up period was to quadruple the GDP by the year 2000. But in order to do that, you really needed to know the denominator, which was the total population size. So to help China in the early days train demographers and get organized for the population program, at that point, the one-child policy hadn't launched. It was really more about just manufacturing modern contraceptives, counting the population, training demographers, and a variety of other programs. That was a really interesting time to be in China, 1980 to 84, right after the end of the Cultural Revolution and the very beginning of the reform and opening up period. I really divided that first year into two periods, like pre-trial of the Gang of Four and post-trial of the Gang of Four. It was a very traumatized time in China for many people, and huge distrust of foreigners, especially Americans. There were 2 Americans working in the UN system, which was tiny. I don't think we were more than 20 people for all the UN agencies in China. We worked closely with the Chinese government. Americans were particularly suspect, I would say. It was a pretty isolating time in those early days. But post trial of the Gang of Four, there was sort of a collective sigh. I felt opening up both emotionally and in terms of more people coming in, more activities happening, people being more relaxed. I wasn't working on HIV/AIDS then, and in fact, there was very little discussion or even acknowledgement. That was the very, very early years of the HIV epidemic globally, and China just, said we don't have any HIV/AIDS for the longest period of time until the epidemic really started exploding in the late 80s and early 90s in southwest China, in the Golden Triangle area in Yunnan and the bordering, Laos, Myanmar, among injecting drug users. I had had a lot of intervening experience after leaving UNFPA in 1984 to do my doctorate at the Harvard School of Public Health. I got very involved in the global HIV/AIDS response, managing the AIDS and Reproductive Health Network at the Harvard School of Public Health. That was a collection of epidemiologists and social scientists from around the world in Thailand, Mexico, and Ethiopia, among working with sex workers and HIV prevention. And then by the time I went back to China for the Ford Foundation in 1996, I was really aware of the exploding AIDS epidemic in China and the need to really get organized quickly in order for it not to, really get out of control, even though China was in full denial. Started working with the donor community there with UNAIDS and with several of the other donors like DFID that were meeting together as a donor group to try to mobilize the Chinese government, what was going on with AIDS, and put in place some effective prevention programs.
And Joan, you were one of the few on the ground in the 80s, and could you share with us what was it like? What kinds of partnerships and conversations were possible? What particular challenges?
Well, the 80s was really early days for the reform and opening up period, right? The donor community was pretty small. It was mainly the diplomatic community. There were very few UN agencies represented in China. So we had a very special relationship. I would say the UN, China maintain today a national relationship with the Department of Foreign Economic Relations and Trade, our counterpart agency there, and with our colleagues who were assigned to us from Ministry of Foreign Economic Relations and Trade to the UN office. I traveled a lot for UNFPA in the early 80s. We had 20 projects. I was the international program officer, and the 2 national program officers. We had a project with UNESCO on sex education in middle schools, and I traveled to 10 middle schools in really rural counties around China, in Henan, in Shandong, in Hubei, many, many places, and often the first foreigner anybody had seen in a very long time. I had a very interesting experience. We did a lot of really good work, and I made many, many good friends at the ministry level with people who, went on in their own careers into more senior positions, and many of whom I reconnected with when I came back for the Ford Foundation in 1996, which allowed me to really start with trusted relationships. For example, at the Ministry of Health, the Ministry of the State Family Planning Commission and other places, Ministry of Education, on some of the Ford Foundation projects that really helped move China forward in many ways. It was a different period of time, and China was very, very receptive at that point to development assistance and funding. Not true today, but certainly at that time, we were warmly welcomed. I made many, many grants, small grants, $20,000 or less, that were highly impactful in China. A small amount of money went a long way, and I had a very large budget, probably $2-3 million a year. And able to bid on more. It was a rich time for the Ford Foundation as well. So,
When you say the China side was receptive, can you describe what that was like? How did they speak with you? What kinds of partnerships were you building?
yeah, well, I came in as the second program officer for my portfolio at the Ford Foundation. The reproductive health program was gaining steam globally. There was a big New York part of it and 14 field offices, many of which had reproductive health programs. It was in the years leading up to the International Conference on Population and Development in Cairo, ICPD, in 1994, which was a very significant, every 10-year global population and development conference. The China office opened in 1988 because of the one-child policy and the need to really look at reproductive health and rights within the population policy. That was a lot of what my portfolio was about. But I also began the work on HIV/AIDS.
Joan, so after working for the UN agencies, you then left China and you came back to work for the Ford Foundation, an American philanthropy organization. What were the differences between those two organizations, and how did China counterparts receive you differently as a
Yeah,
result of who you represented?
we had a lot of independence. Nobody really questioned the judgment of the program officers who were selected for their expertise in different areas where they had their portfolios. It was a great job, actually. We had a lot of independence to decide how to move our issues based on our own program strategy, who to fund, and those were only really rejected for legal issues or other issues. Of course, you needed your representative's approval, the office approval, but we were very independent. A set of program officers with a lot of discretion to move the issues however they felt the grants program could do so. But that's not true anymore. The foundation has changed a lot. I probably was in the golden period of the Ford Foundation in China in that way, as opposed to now where it's much more centralized and organized and different approval process. But the UN is nothing like that. The UN is a big bureaucracy and works directly with government counterpart for every project. It's all consensus and driven.
As I hear this, I can't help but hear echoes from history, and there's a long tradition of Americans doing health-related work in China, from 19th century Peter Parker building eye hospital in Guangzhou, and Yale in China doing the Yali Medical School and hospital, and obviously the Rockefeller family founding the China Medical Union. China Medical Union Hospital, whichever.
Peking Union
Peking
Medical
Union
College.
Medical College.
Yes, Peking Union Medical College. 协和医院. So jumping into the AIDS and the 90s with HIV/AIDS epidemic, how do you see yourself in this historical lineage? Did you think of that much? Did you know much about it when you first went in?
Yeah, I did know a lot about it because I'm really a China wonk, first and foremost, before a global health person. I did my 2 degrees in Chinese studies and then I did a doctorate in public health. But the Chinese health system and medical history I've written quite a bit about, including the Rockefeller Foundation, who incidentally funded my PhD research. So I felt like I was, evolving in a tradition. But Ford was really the first foundation to establish a field office in China in the late 80s, and pre-Gates Foundation by a long time, probably by 12 years or more, around 2000. And So I think we played a really interesting role in that evolution of health assistance because Ford was really focused on community-based approaches, including the development of the civil society and an NGO community. And my program and the other portfolios in the office were deeply involved and in a very open period. The 90s allowed the development of civil society in China in a really unique and important way. We were explicitly building and with government support a set of civil society, real genuine civil society actors on women's rights. So there were many women's NGOs that um, uh, were established with the support and assistance of the Ford Foundation in preparation for the Beijing Women's Conference in 1995 that became some of the leading women's rights organizations in China. And similarly, in the HIV/AIDS field, uh, I played my portfolio played a very important role in building groups like the China Association of People Living with HIV/AIDS, the Positive Peoples Network that were patients, HIV-infected people that were playing a role according to UNAIDS JIPA principle, the greater involvement of people with AIDS, so that they were at the table for discussion, the affected communities. And then connecting that group in China with the global network of people living with HIV/AIDS. So a lot of the Ford work over the years was connecting up the transnational civil society networks, sending Chinese organizations to the regional AIDS for the women's conferences, prepped for the larger conferences, and connecting up those global civil society actors with the new organizations in China for strategy, for networking. That still exists, even while many of those organizations are no longer in China post NGO law, which began in 2016. We were working with the academic researchers to fund important research on behavioral research on HIV/AIDS, what was happening with the more public emergence of a gay men's community and the risk there for HIV/AIDS with sex worker risk. We funded a lot of the behavioral research at Renmin University, the Institute for Research on Gender and Sexuality, Pan Sui Ming's group, and the fabulous set of studies that came out that were very influential in shaping the HIV response in China. And then working directly with government, with the Ministry of Health. We worked in partnership with UNAIDS and other organizations on the Global Fund for HIV/AIDS and TB. We'd sit at a table, the donor community, with the National Center for AIDS and Control at the China CDC, and draft the Global Fund proposals, right? It was a joint effort, a collaborative effort to get more money into China to address the AIDS epidemic in the early 2000s. And of course, the policy changed in 2003 after SARS. And that was largely a result of the donors working with the National Center for AIDS Prevention and Control at the China CDC to take advantage of the post-SARS environment that China needed to not be in denial about the AIDS epidemic, urgently put in place a prevention and treatment program after 2000. When the epidemic moved from southwest China into central China, Henan and the surrounding provinces in the 90s through this paid blood donation scheme. A lot of rural villagers in central China were infected with AIDS, passed it on to their kids, left a lot of AIDS orphans, and it was a time of denial when people were getting infected with HIV/AIDS, not stigmatized drug users or gay men, right? So it exploded into the open and became a catalyst for the policy change in 2000.
So, Joan, you mentioned HIV as a catalyst. Could you share a bit more about that? Because HIV/AIDS has been framed as a kind of pivot point for China's health system reform, forcing it to confront civil society and transparency and rights in new ways, whether the stigma or the disease itself. What's made it different from other health crises in China?
Yeah, I think it forced the government not to just treat it as a medical issue. That was the story of AIDS globally. You had UNAIDS come into being and coordinating all the other UN development agencies around the social determinants of health and creating an enabling environment for the AIDS response. So many people were dying in Africa. There were debates about access to essential medicine that were resolved around the late 90s. You know, by the global actors and the pharmaceutical companies, right, about allowing antiretroviral life-saving drugs to the people who are actually dying of AIDS in Africa, right? It was a huge set of global debates, uh, echoing with the COVID vaccines, I would say, in terms of access to essential medicine. How do you get those drugs to the people who need them? The whole enabling environment issue, the way in which stigma affects people self-identifying and coming forward for treatment, many, many aspects of that got on the global screen for the first time. And then you had this very active agency, UNAIDS, that really did put it on the map and keep it on the map. There were, in General Assembly meetings and the creation of the Global Fund for HIV, AIDS, TB, many things that happened in the early 90s. And I think it shaped the way people think about responding to health crises. We saw echoes of course, in the COVID pandemic, right? There should have been some more lessons learned from the AIDS epidemic that, we didn't take forward. But, many other things shifted the discussion of, you can't just approach this as a medical or a tech fix. It's, you've got to really look at how to create an enabling environment. And so back to the civil society piece of that, for example, sex workers, gay men, drug users, you need these peer groups, right? You need people who are representatives of those groups to be able to actually reach their constituency. You need community-based organizations made up of like people, to reach and access those communities with HIV prevention, messaging, and technologies, getting people to get into testing and treating. HIV is a chronic disease these days, right? Especially now, there's once a month or once a year injectables. We're moving so quickly towards making it a manageable chronic disease, right? But the first step there is getting people to test and treat. Stigmatized and marginalized communities to reach out through peer messaging and peer approaches. So that's why civil society was so important in the AIDS response and remains so. I mean, we see the new wave in China is young gay men, right, who are not being reached with HIV prevention messaging, which is tragic because treatment is free actually and available. How do you get the International Labor Organization work to protect labor rights for people with HIV and hepatitis? Those efforts through other sectors didn't really happen until the AIDS epidemic. Why do people not self-identify? They don't want to lose their job. I left China in 2001, and I felt really my unfinished business was to work on getting all those international best practices in place in China. So the AIDS Public Policy Training Project was very much that. I had a team of 10 faculty at Harvard and working with a counterpart faculty in China where we were doing training at the municipal and provincial level for government officials, multi-sectoral groups about these policies and practices for the HIV response.
Long-standing suspicion against foreign NGOs and foreign actors. They're certainly often not looked upon as likely friends with the bureaucracy, likely partners. And it's astonishing looking back and realizing how much of it worked, right? How many NGOs operated in China for however long the government welcomed, allowed foreign NGOs in China. I mean, eventually, the Global Fund did exit from China, specifically on the point about civil society. And the Chinese government came up with foreign NGO law around 16. So that's probably the end to this period of opening, which lasted for 2 decades. So, Joanne, if we're trying to get into the minds of your Chinese counterparts, especially those in the government, why did they come to allow this whole field of uncontrolled foreign actors working with activists and civic-minded Chinese who are not necessarily the most obedient to the state? I mean, what's the logic there? How come this whole field got to take off for as long as it did?
Well, during that early period of, say, 2000 to 2010, and speaking specifically about HIV/AIDS, there was a recognition that by the government, of two things. One, that they needed the peer groups, the NGOs, to reach the affected groups. Once the AIDS program was put in place, starting in 2003, they couldn't do it without access to the communities that were the most at risk for HIV/AIDS. And that required engaging with these civil society groups, no matter how much they didn't like them, to reach those folks, right? It was a pragmatic recognition that the only way they were really going to get on the right side of the AIDS epidemic in China was to engage with a set of civil society actors that could reach the affected people that needed to be reached. So that was the pragmatic side of it, and that's the story of the AIDS epidemic everywhere, not just in China. And the other part of it, which is I think more important, was to get the money from the
Mm.
donors and the development assistance. They had to do it. The Global Fund had a requirement for civil society representation, coordinating the country coordinating mechanisms. And so even if they had to fake it, they had to do it in order to get the money, right? But I think it was a genuine understanding by certainly the bodies that were developed during that period of time, the State Council AIDS Working Group, the SWACO. It was a very progressive organization made up of people who really what the global experience was and what they needed to do in order to really get on the right side of the AIDS epidemics. The only USAID money in China was for AIDS in Southwest China in 3 provinces, and it required civil society representation, which was a huge amount of money. I can't remember how many rounds of Global Fund money came into China, but had a explicit requirement for civil society. And part of the China Society for AIDS Prevention and Control, or whatever the parastatal NGO was, acted as the umbrella agency to receive the money and then distributed it to the smaller real NGOs. It worked to some degree. And then there were other organizations. I worked very closely with a group called Friends Exchange, started by a doctor in Shandong province in Qingdao, and it was a magazine for gay men that was handed around, mimeographed and distributed before the AIDS epidemic. It was the only kind of organizing body of gay men in China, and it had a lot of HIV prevention information in it. And an outside organization that funded a lot of work on HIV for men who had sex with men, called the Barry and Martin Trust, came into China and started supporting the Friends Exchange network. And then Ford Foundation took it up, and it became an official publication. It became an enormously important way to reach the gay community with HIV/AIDS prevention work. And it was embraced in a way by the government because it became an important access point for an important community that needed to be reached. I would say it was a golden period there before the NGO law came. And I would say what happened was, with the current government and political leadership that started evolving around 2012 or so, there was much more of a reflective process of the role of civil society and funding the color revolutions in Eastern Europe. And I think the current leadership in China really reasserted the distrust factor for civil society and its potential for peaceful evolution. It came out with a set of don'ts, right, which included civil society and rule of law and many other buzzwords that closed down the space for the kinds of rich activity that happened with the HIV/AIDS organizations during the late 90s and the early 2000s.
Yeah, I wanted to build on that during this changing global health international development landscape. My last episode, I spoke with Sid Chatterjee, who's the UNRC over China, and he was talking about how the UN engages with China today, which is very different from when you started with UNFPA and even later with the Ford Foundation. So how do you reflect on your past and think about this current engagement?
Yeah, well, I do think that the China of 90s that I arrived in working for the UNFPA as a completely different country than the China of 5, right? Certainly, it's no longer the case that you could do any of the stuff that we did. It's a much changed political environment. Many of those organizations still exist. They don't have the foreign partners, and they certainly don't have foreign funding. Many of the donors exited China, felt that Africa or other places needed donor assistance more than China did. But China's really come up. It is middle income for sure, and lots of cash reserves and a development donor itself, right? China has adequate resources to fund its own health and development programs, but it doesn't mean it doesn't need technical assistance to improve what it's doing and how that money is delivered. And I regretted what I saw happen starting in the early 2000s to where all the donors either reframed their programs as China for the world, UN agencies, the Gates Foundation, the Ford Foundation really reframed their own portfolios so that it wasn't about China for China, but what could China do for the world, or how could China help engage with the world. And I think there's a lot of unfinished agendas in China, to say the least, right? Many, including in the HIV/AIDS world. China is a donor through the Belt and Road, especially during the COVID pandemic, making its vaccines available to many countries in the world. China has a lot of really educated public health professionals who've been educated abroad, educated in China, Tsinghua, Beida, Fudan, who've worked at global agencies like the WHO and come back. So China's, got a lot of its own health expertise and is extending its own power out there in the world, especially to Africa. But I do think there are continuing challenges, and the NGO law has made it very, very difficult. Plus, the weakening of the UN system in this current geopolitical moment that we're in. The UN is very engaged with China, right? But the global system have changed so much in these last 10 years. It's harder to collaborate on global issues. To some degree, the UN and the multilateral system are engaged with China, but the US certainly isn't, and Europe less so, as well as the world aligns around the big powers, the new conflicts. And it's harder to get the collaboration we need globally for pandemics or anything else. I worry deeply about a resurging HIV/AIDS epidemic with the demise of USAID and all the money that many of the foundations and big donors have stepped up to try to fill some of the gap on the most important issues like immunization and parts of the PEPFAR program and things like that. But USAID was the biggest donor. It provided like $12 billion of global development assistance for health. And the next biggest donor was the Gates Foundation with like $1.2 billion, right? So it's an order of 10 at least, right? And the absence of that money in the global space is hugely impactful. I worry about what it means in sub-Saharan Africa, where many of the organizations have been dismantled that are the front line of providing HIV/AIDS care, prevention of mother-to-child transmission, and antiretroviral treatment, working with young women who are really at risk of AIDS because of the social determinants, of health and the lack of an enabling environment that supports, um, them refusing uh, risky sex. So, I just worry about the world right now.
Joan, you mentioned about the dismantling of the American aid system in the current administration. As Trump complains, it hasn't been very good for American soft power. So we might as well just dismantle it because it's not bringing in the political perks. And so as China looks at this, I can see them thinking, given all that's happened, maybe it's not a good idea to do humanitarian aid and we should just focus on the soft power piece. The US is stepping away. Is China going to step in and take the same role as it was once filled by Western development aids and development professionals? What's your view on this, John? If China is this rising power, what kind of China-led global development landscape will it look like? reason
Because
governments.
Yeah, well, so in the global space, first of all, I don't think China's going to fill the void. It's transactional to some degree. The term soft power, has many things. I think people look at the PEPFAR program in particular as an extension of American soft power because it was providing a huge amount of money for AIDS relief for sub-Saharan Africa. That, you could say it was in the U.S. interest to prevent the explosion of AIDS in Africa in terms of global stability. But, that was kind of like a secondary issue. It was much more of a humanitarian effort. I think global health assistance is maybe unlike other soft power, like, Hollywood or the transmission of ideas and values through the media. Global health assistance is humanitarian aid first and foremost. And I come to it in my career very much as a health social justice person working on humanitarian aid with health as a global public good, providing health assistance to poor people who need it, primarily as a human right. So I come at it as a real do-gooder, and I'm not an international relations realist person who's looking at what do you get for giving global aid? What do you get in return from the geopolitical point of view? But I do think that does shape the way governments approach it to some degree. Certainly, Trump doesn't see any value in it. That's the end of USAID, right? But that's wrong because I think China is playing a role on the humanitarian side, but also to build up its own credibility and importance in the global space, especially as the U.S. recedes, providing money to especially the UN agencies like WHO, not making up for the U.S. shortfall, but making a significant contribution and also trying to play a role in bilateral development assistance on key issues like Africa CDC or on malaria, always with the interest of China in the first place. We're in a complicated world, right? There's a lot of pressure on governments to take up more of their own health budgets. A lot of development assistance money has gone into defense because of the potential for war in Europe. So many of the big donors, the British government, France, other places, shifting funding from, you know, health education charity programs or humanitarian programs into defense budgets. USAID has gone away. The UN system is taxed in terms of its donations. So there's just a lot less money available for development assistance. The golden age of global health is over. There's no question about it. I watched not enough money going into global health for much of my career. And then the HIV/AIDS epidemic shifted the donor space in a massive way so that much more attention was paid to global health and the spillover into things like immunization programs and maternal and child health. Those days are over. That money's going to have to come from somewhere else. The foundations are stepping up to some degree to fund Gavi, the Global Alliance for Vaccines and Immunizations, and putting money into some of the other key assistance programs and things like that. But those money that we saw over the last decades is never going to be the same, in my opinion. And governments are being pressured to fund more of that out of their own domestic health budgets. So it's a changed world.
Joan, you mentioned that you're worrying deeply about the resurgence of a new HIV pandemic. Can you share a bit more about HIV in China today?
Mm-hmm.
Because it's not solved. What parts of the issues are enduring, whether that's stigma, financing, data, and what parts of the response and the solutions have also endured successfully? And then because diseases have no borders for the rest of the world too.
Yeah, the HIV/AIDS response in China is a success story in many ways because once the policy changed in 2003 in the post-SARS period, you had these advocates waiting in the wing to make the case of the need for transparency and direct action, and it happened. The government put in place a free testing treatment program, and including a certain amount of poverty alleviation, care for orphans. That has endured. The treatment is not optimal. It's not the most advanced medication, the easiest to tolerate, but it is life-saving, right? China can do that. They can, you know, negotiate with the drug companies, get better medicines and medications. But where's the new wave of the epidemic coming from? It's young gay men, right? Everywhere in the world, there's a certain complacency among young gay men about HIV/AIDS because they've grown up in a world where there's treatment and they can say they don't think they're going to die of AIDS, right? But you know, you don't want people getting infected with AIDS. There are things that China should be doing, rolling out a full scale to prevent people getting infected that isn't really happening effectively. There's been a loss of attention away from it. China has the resources and the capacity and is providing the drugs, right? But more people need to get into tested and into treatment globally. Where we're looking at the possibility of a resurgence, especially in Africa, because of the weakening of the organizations there with the loss of development aid. And then probably the reluctance of African countries to put the resources into it that they should be doing themselves through their own national health budgets.
You've worked in the field in China in multiple periods, and then you've also gone back home to the US teaching as well as running programs. How did people back in the US view your work in China? Was it different perspectives, different biases? You know, what was that like?
Well, I think the moment for me was sort of post-COVID when I was, you know, planning to go back after 3 years of Zoom life with my Chinese colleagues at Tsinghua in April 2023. The geopolitics of the relationship with China in the US had changed so much that people said, "Aren't you scared to go back? Are you worried?" I have had a whole career since 1980 where I've lived in China for probably 15 plus years and gone back probably 2 or 3, 4 or 5 times a year, every year pretty much since 1980, right? And it's like my second home in a way. Beijing is so familiar to me. I wasn't the least bit scared. I was really looking forward to it, and it was so normal when I got there, right? But I think that environment has changed. Whereas it was kind of cool that I was working on China for so long, now it's sort of weird because there's so much anti-China sentiment in the United States. The view of China has changed so dramatically. China's approach with much more suspicion and distrust.
Yeah, suspicion even on global health technical collaborations.
Well, I think colleagues that are more reluctant to engage with China because they feel the risks that it brings to their institutions in the United States or potentially to their professional career in terms of being able to work with the U.S. government, for example, right? That's less so, I would say, since Trump came to office than it was during the Biden administration a couple of years ago. I think things are softening a little bit, but there is a certain amount of reluctance to engage with China from any area of science and technology because the security overlay is so intense, and they feel that the risk to future funding might result from that.
As we look at China today, it looks a lot like America, even though the one-party state is there. It is a market-based system. The CDC is modeled after the American CDC. The National Medical Product Administration is modeled after the FDA. The lawyers were trained in the American legal tradition. Tsinghua was founded by Americans, and obviously the stock market comes from the New York Stock Exchange, and so this process of transformation that turns China from a Soviet model to an American model really happened throughout your career, essentially. One step at a time, one grant at a time, one project at a time. And for a long time, China did play that willing role in terms of we're trying to learn from the West, trying to reform. And now the Chinese government is trying to redefine the term reform, which is very telling of where we're heading. And so living inside that whole period of transformation, Joan, I really wonder about your view on, how much of China today is really the product of American effort. It's still very much Chinese, and the roles that your Chinese colleagues, partners, grantees, counterparts, the role that they played in shaping the system as we know today. I mean, how do we divide the blame?
Yeah.
To be fair to both sides.
Yeah, I have to say the U.S., especially in the health area, the CDC, the NIH trained up the Chinese health science side of things to an enormous degree. A lot of collaborative research grants, a lot of CDC supported programs. The US CDC GAP Global AIDS program was there for many, many years, working in concert with the China CDC. We trained up the China CDC and the EIS program, the Epidemic Intelligence Service. The Chinese system looks a lot like the American health agencies in important good ways. The U.S. has been at the apex of health and medical research for decades. China has really benefited from that. We partnered with China to make China's global health system better. And they're probably going to just leave us in the dust because of all the science and technology funding that China provides, and which we're not providing at the moment. We're giving up our lead position if the lack of funding continues.
Earlier, you mentioned there's an unfinished agenda that many of the global health professionals feel out of China over the past 10, 15 years. What do you think is the unfinished agenda, the parts where China is still not getting, and it would actually be in their own interest to get that part?
Yeah, I mean, I think it's the civil society piece. I really feel that the contributions of the community groups and voice in the governance process, it's not optional. It's a requirement for doing better, more targeted work and for getting support by the communities that you need to reach. So that part of it is going to play out. We saw it already with the COVID response, the protests, the pushback, from the Shanghai lockdowns and things like that. I just think that piece needs to be part and parcel of the way we approach global health. And I think a real, acknowledgement of the enabling environment issues, which comes from more multi-sectoral engagement. Those are instrumental for effective health interventions that are lasting, this important role of NGOs and civil society. I truly have seen it in my work, especially in the HIV/AIDS space. And I think the other part of it is just the global collaboration agenda, especially between the US and China. You can have a certain amount of global collaboration without the US, but the two biggest actors in the world, with the biggest influence and reach at this point, need to be working together on the next pandemic, for example, or on really dealing with other types of risks that are going to spill over into the health areas. We need to find a way to get back to the table on these key humanitarian issues for which the whole world is potentially at risk. COVID was the prime example of, why we need to be working together on the emerging infectious diseases. We need to be working together with China, the leading virologists in the world, on the One Health agenda. We have to find a way to get past the geopolitical tensions. So my hope for the future is that we can move to more collaboration on global health risks between the U.S., China, and the rest of the world. So.
I'll round off with one final question for World AIDS Day, 1st of December 2025. I did a quick Google, and the first ever World AIDS Day was in 1987, 38 years ago. So, Joan, you've worked through many World AIDS Days since. Can you share any memories of how you celebrated this day with your HIV colleagues or in your research wherever you've been, whether in China, the US, or somewhere else in the world?
I mean, it's always been a big deal in my professional career. I've participated in many programs on World AIDS Day with lots of different people and different tables in China. In the heyday of the donor collaboration on AIDS, in probably the early 2000s, everybody would convene. We would have, a huge public event, Zhongshan Park or someplace like that, with posters and activities with everybody participated. And I feel these days it has way less visibility and prominence than it did. It's become more routine. It's become more just like any other disease, that exceptionalism of AIDS, which is good that it's not exceptional anymore, that it's more mainstreamed, right? But I feel that within the public consciousness, it's not global calamity, global disaster. We have to pay attention to it and be aware of it.
The paradox of public health, when you're healthy and well, it's silent.
Yep,
But when you're ill,
exactly.
then there's noise. So that is the difficulty with prevention
Yeah.
in healthcare.
In my earliest days working with the UN AIDS office in China in the late 1990s, I was very close with the two people who were fabulous conveners of the donor community in China, Emile Fox and Sun Gang. We would regularly go off for beers and unpack AIDS response in China, like all the different actors and all the missteps and all the things that weren't happening before the AIDS response really took off in 2003. I think my most memorable, uh, you know, recollections are of the sitting around a table with beers, really just trying to spitball what needed to happen. And to the credit of them and to others, those many of those things mobilized over the next 10 years to put in place an effective AIDS response in China. I would like to finish by saying is that what I'm doing now, which is educating the next generation, that for me is just as important or more important than anything I've done in my life, because I feel that I'm going to exit the scene, but it's people like you, Ruby and Leo, you're going to take forward this important work in global health and U.S.-China relations in China and the world through our program, the Schwartzman Scholars Program. And I feel we need to build up the next generation of activists who understand history and can engage on your own social justice paths.
Much. This has been
Great.
so great.
Yeah,
Yeah,
thank
it's
you,
really,
Ruby. Thank you,
yeah,
Joan.
yeah.